replacement of a mercury amalgam filling in an upper second molar tooth. Of course, rubber dam is imperative when you're placing composite fillings or removing a mercury amalgam. The rubber dam prevents the mercury amalgam from flying around in the mouth, and we use high water and suction to remove it. In this case, we also had prepped 3 teeth for full crowns. This is a carbide burr. This is the barrel diamond burr to freshen the margins. We etch with 38% phosphoric acid. Now remember, you etch dentin for 15 seconds and you can etch enamel for up to a minute. If you etch the dentin more than about 15 seconds, the dentinal tubules will collapse and the primer will not flow into the dentinal tubule and you won't get the hybrid layer. Irrigate thoroughly for about 15 seconds to remove the etch. Now this is a very important part. Leave the tooth wet. Don't try to remove any of the water. Take the pledget, dip it in the primer adhesive and place it in the tooth preparation. The water will be displaced by the pledget, and I'll move the pledget with primer adhesive from the dish to the prep several times. So you're flooding the preparation with primer adhesive. Remember, the primer is attracted to water. The carrier in the primer, either acetone or alcohol, is attracted to water. So if you leave the water in the prep and in the tubules, the primer will go down into the dentinal tubules and you'll get that wonderful, strong hybrid layer. This also prevents tooth sensitivity. You want to blow all of the primer adhesive away that moves until nothing wiggles. This is a very important step. Many people don't know if you should cure the primer adhesive or not. Always cure the primer adhesive. That way you're sure that the primer adhesive in the dentinal tubules, i.e. the hybrid layer, is set. And remember, sensitivity is caused by movement of fluid in the dentinal tubule. So if you set that the primer in the dentinal tubules, you have no fluid movement and you will have no sensitivity post-operatively with your composite restorations. Now this is a flowable composite. The viscosity in the filled portion of the flowable is almost the same as the non-flowable. And if it's a prep 2 millimeters or greater, I always put a layer of flowable and cure that and then come back and continue filling the preparation. Be sure you leave the tip of the flowable composite in the composite. Don't ever lift it out or you'll get an air bubble. It's very important that you use a rubber dam so you don't have moisture contamination of the margins. It also eliminates the possibility of any saliva washing across the composite restoration before it's fully cured. We cured the composite 60 seconds once it's completely placed. So the curing is primer adhesive is cured for about 10 seconds. Then the first layer of composite, which is about a 0.5 millimeter to 1 millimeter, is cured for 20 seconds. Then the final layer of composite is cured for a minute. Now that may be a little overcure, but you can't overcure it, and you certainly don't want to undercure it. So that's the sequence that we use. Now I'm polishing with a number 6 round burr with high water. This is a Shofu rubber wheel, and I'm doing fine polishing of the margins with the rubber wheel with water. Again, light pressure. Check your occlusion. There we have it.
Thanks so much for tuning in to the Dental Minute with Dr. Stephen T. Cutbirth. Go ahead and press that subscribe button because next week we'll be telling you how to prep a full arch of crowns.